Breaking news, major cancer breakthrough. Jab to treat form of disease that hits women under 50. Thousands of women with the earliest stages of cervical cancer could slash their risk of developing the disease by taking a HPV jab, promising research suggested today. Cervical cancer cases in the UK have plummeted since 12 and 13-year-olds, both girls and boys, have been offered the jab as protection against the disease. But Dutch scientists have discovered the vaccine may have a second key role in thwarting it. They believe that administering a dose to women with high-risk pre-cancerous cells could stop it developing into the invasive, deadly disease. The trial found that in more than half of those who were offered the jab, the cells were destroyed. And after almost 2 years, none saw these cells recur. Currently, women with these risky cells are offered an uncomfortable operation called a loop excision, which scrapes them out of the cervix. However, the surgery involves risks including bleeding, infection, and in some cases could cause complications with pregnancies, including premature birth. Experts today said the vaccine, one of the most effective therapeutic vaccines to date, could pave the way for a new protocol for women, with meaning they would no longer have to undergo the procedure. Dr. Refika Yazit, an oncological gynecologist at University Medical Center Groningen in the north of the country who lead the trial, said that the jab, which researchers called VAX-001, was, to the best of her knowledge, one of the most effective therapeutic vaccines for cervical precancers. She added that, if the results were confirmed in a larger trial, it could mean at least half of the patients with high-risk precancerous cells might be able to omit surgery and avoid all its possible side effects and complications. Around 8 in 10 people will get HPV at some point in their life, and their body will clear it without any problems, according to the NHS. However, 13 out of the 150 varieties of the virus stay in the body for a long time and are known to cause 99.7% of cervical cancers. There are 3 types of cervical precancer: CIN1, mild, CIN2, moderate, and CIN3, severe. These are all abnormal cells that line the cervix. If left untreated, roughly a third of CIN3 cases develop into cervical cancer within 10 years. The figure stands at roughly half after 30 years. That majority of CIN3 cases are caused by a specific strain of HPV, known as HPV-16. In the Phase 2 trial, 18 patients with CIN3 received 3 doses of vaccine 3 weeks apart. All undertook routine colposcopies, a test to take a closer look at your cervix. After a follow-up of 19 weeks, 9 saw their CIN3 cells shrink or vanish. In 3 cases, they were completely destroyed. Writing in the journal Clinical Cancer Research, the scientists said that of these 9 patients, CIN3 tissue size was significantly reduced in all but one of the patients. The other 9 volunteers all underwent surgery, the current standard treatment. But by the time 4 of the 9 patients had surgery, no residual disease was found, suggesting the vaccine may too have worked for them too, the scientists said. Over a follow-up of roughly 20 months, none of the patients had recurrences, they added. The scientists, however, acknowledged the trial had some limitations, including a small sample size and a follow-up time of less than 2 years. In the UK, the HPV jab was offered to all girls in school year 8 since September 2008, but eligibility was only expanded to boys in year 8 from September 2019. Currently, women aged 25 to 49 in the UK are invited for a cervical screening check at their GP surgery every 3 years. For those aged between 50 and 64, it is offered every 5 years. Screening is arguably all the more important for women aged 34 and above who did not receive a vaccine that protects against the vast majority of cervical cancers as part of the school program introduced in 2008. Depending on the result of the smear test, some women may be recalled earlier than the 3-year routine intervals. But screening uptake overall remains low. Only around 70% of eligible women, roughly 4.6 million, turn up for their scheduled test. Embarrassment is a factor, according to research by cervical cancer charities. For half of the 1.3 million no-shows every year, getting time off work and finding a convenient time to fit in an appointment are the other reasons they miss it. In 2023, the NHS pledged to drastically slash the number of women struck by cervical cancer by 2040, vowing to boost uptake of both the HPV vaccine and cervical screening. However, elimination would technically be achieved when fewer than 4 women per 100,000 are diagnosed every year. For comparison, The rate currently stands at 9.5 women, equating to around 2,600 annually. This means around 1,100 women